Hi, I'm Dr. Brian Wong, founder and CEO of the Bedside Trust. A question that I've rather enjoyed asking of physicians across the country recently is, tell me what you know about leadership. Think about your training as a medical student, intern, or resident. Tell me what you got taught, what you learned about leadership. And they all look at me and they say, nothing, less than nothing. And the problem is we're so disadvantaged because we never got any leadership training or competency, and we have no clue how to conduct ourselves in these kinds of leadership meetings or problem-solving sessions and things of that nature. Well, I'm here to tell you that we actually did get taught everything we need to know about leadership. The problem is nobody ever told us that what we learned had a context outside of direct patient care. Let's consider what we actually were trained. What constitutes the practice of medicine? It took me 7 years to learn a simple 4-step technique. Do a history, do a physical, formulate a differential diagnosis, execute a treatment plan. History, physical, diagnosis, treatment, the medical workup, over and over and over again, every patient, every time, everywhere, by every physician. The question had to be, is it only useful with direct patient care? Could you elevate the context to have it applicable to complex organizational problems? My answer is absolutely. Because when I think about a history, what we're doing is we're listening. When we're doing a physical examination, we're observing. When we're putting together a differential diagnosis, we're formulating and synthesizing. And then when we are treating, we are executing. That's really no more, no less than what executives and healthcare leaders do every day. The best executives listen, observe, formulate, and execute. But now I'm using language that fits into a familiar framework which physicians have used for over 100 years. We've taken the medical workup and migrated it into a leadership workup. And we've created a series of questions that lead us through in a disciplined way how we can solve even the most difficult, complex organizational problems using this familiar medical workup framework. Question number 1 is what matters most to patients, because that's what patient-driven leaders ask. What matters most to patients, the answer, of course, is trust and confidence, and for them to be in the hands of highly competent professionals who care about them and who are working together to solve their problem and help them feel better. When you go into the observation part, what are our observations about what drives us crazy in the current state? And the observations are all of the things that contribute to distrust. Too much to do, but compounded by bad attitude and disrespect. Every man for himself, silos and turf wars, shutting down, callousness, and isolation. And when we go to the root cause, what is the root cause of the things that drive us crazy in the current state? It always traces back to this across the nation diagnosis of distrust, the distrust cycle. And when we consider the root cause of the distrust cycle, it's a breakdown in understanding, in respect, in teamwork, and in personal safety, hence a lack of role clarity. So therefore, countermeasures, when we talk about executing a treatment plan, must be focused on restoring trust through role clarity to break through the cycle of distrust, which is at the root of what's driving us crazy in the current state and getting in the way of the ideal state of providing what matters most to our patients and what matters most to us. Imagine that wisdom from 100 years of being a physician could actually inform healthcare leaders about not only how to solve complex problems, but how to create cultures and environments that enable all of us to feel like we now control our own destiny. When you put groups of people together and go through this leadership workup in this sequence, what's the ideal state, what's driving us crazy, what's the root cause, what countermeasures do we undertake, it becomes much more clear to everybody as they discover things together that what matters most is trust, what drives us crazy is distrust, the root cause of that being a lack of role clarity, and therefore there's this aha moment, this forehead slapping moment that says we're doing this to ourselves. The place we've been hating is the place that we've been creating, that we must commit to becoming trusted. We must learn how to solve problems together, that the problems that are all we thought operational in nature all have relational roots, and relational problems can be solved first and foremost with a choice to establish role clarity in each of us, choosing to become trusted colleagues. This is how medical workup has informed our work in the leadership workup, and how the leadership workup is at the foundation of helping us master this skill of group problem solving. When you have effective group problem solving, you have effective teamwork. If you do not master this skill, teamwork is nothing more than an oxymoron. Two words that just don't make sense together. Team work doesn't make sense. But when you have group problem solving, you have effective teamwork. And these effective teams now begin to deliver what matters most to patients. This connects back to patient trust, which is what we do in our role as patient-driven leaders.